And now, Wellness Wednesday, brought to you by ExpressCare Urgent Care Centers, a LifeBridge health partner.
Well, it is Wellness Wednesday. Flu and respiratory illness season is here. They're on the rise. Many people are feeling the effects.
Feels like everyone we talk to these days, somebody's got the flu, knows somebody who got the flu. So joining us today is Dr. Thierman from ExpressCare Urgent Care Centers to talk all about the recent uptick in these illnesses. So thank you for joining us, Doctor.
My pleasure.
Yes.
Man.
So tell us, why do you think these flu cases are spiking? And I feel like it's a bit earlier this year.
Yep, absolutely. It's early and it's higher than normal, and it's probably because it's one of those years where there was a genetic shift of the flu virus. It's a flu A virus this year. They're calling it flu K. It's subclade K. That's the name, and unfortunately the shift happened after the vaccine was developed. So the vaccine is not as effective at preventing flu this year, and so we're seeing an early spike in flu.
Wow, it seems you're always chasing that strain, you're trying to figure it out. But even though it's not that particular one, what do you say about people who say, well, then why get the flu vaccine? Yeah,
it's a good question. You know, it's still effective. It's just not as effective. The numbers are usually in the 50 to 60% range for preventing flu, and this year it's probably closer to 30 or 40%. However, it is still effective in reducing the severity of the flu. It's still effective in reducing the transmission of the flu, and it's still effective in reducing the duration of the flu. So it's going to help you survive the flu better than it would if you didn't get the vaccine. And in 30% of people, it will help you not even get the flu.
Nice.
Well, that's good to know. So it is also that time of the year where it's not just the flu. There probably are other things that we're catching. What are you noticing?
Yeah, well, we're seeing it all. Respiratory illnesses are amongst us. The flu is by far the predominant one. But in urgent care and in emergency medicine, all medicine, we really don't want to have blinders on. So we want to make sure we still test for COVID. We're still seeing COVID. We want to check for RSV. We're still seeing RSV. There was an RSV spike in the fall, and that's still with us. So we want to kind of check for all these different things and not miss something.
What is the protocol for folks? I think some people, well, they say don't come into the emergency room if you have the flu. Wear just a mask, it'll pass. What do you do if you feel like you're starting to get those symptoms?
Urgent care.
Urgent care,
yeah.
Okay.
We want to protect the emergency departments for people who are very sick. The hospitals are really feeling a crunch these days with flu admissions. There's been about 2,000 hospitalizations from flu. Sadly, about seven deaths so far in Maryland. And urgent care is the best alternative because it is fast, it's convenient, and most importantly, if you get treatment, you're going to prevent the transmission to other people. So not only do you save the emergency department for the very sick people, but you also maybe will cut down on the transmission, and hopefully this spike will come to an end.
Okay.
And this also comes when everybody was traveling during the holidays, so that I feel like plays a big factor. Are you noticing anything with kids in particular?
Yeah, this year the predominant feature, the symptom that kids mostly present with is a high fever. So we're seeing kids spike a fever. They come into ExpressCare, we test them, and most of the time it's flu A, probably the subtype flu K. But kids are vectors. That's what kids do. They are very good at tolerating the flu. They do just fine clinically themselves, but they're great at spreading the flu around to their classroom, to their families. So another good reason to get kids tested, and if it's the flu, treat them because it will reduce the spread.
Okay, so we have your website up, of course, goexpresscare.com, and I guess parting advice, washing hands, wear masks.
Yeah, all that. Don't hesitate to get tested. I think people in the post-COVID era have been more relaxed and want to stay home, but truly knowing what you have and treating it early is good for yourself, and it's good for your classrooms and your families. And then lastly, telemedicine is a great alternative. You don't have to even leave your bed if you need to get seen, and you can get prescriptions and get taken care of without exposing yourself to the waiting rooms, and also just very conveniently.
All right. Doc, thank you so much, and stay away from those snotty-nosed little kids.
Yes.
Thank you so much.
Wellness Wednesday on WJZ at 9 is brought to you by ExpressCare Urgent Care Centers, a LifeBridge health partner.